Hello and welcome to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to go over what an open wound is. But first, if you could hit that subscribe button, it would be greatly appreciated as it truly does help my channel grow. So what is an open wound? So an open wound is an injury involving the external or internal break of the body tissue. Okay, so nearly everyone is going to experience this at some point in their life. Most open wounds are minor and can be treated at home. But falls, accidents with sharp objects, car accidents, they're the most common cause of open wounds. And if there is a lot of bleeding or bleeding lasts more than 20 minutes, you should be seeking medical attention. Okay, so there are 4 different types of open wounds. So we'll go over those first here. So we have an abrasion. This occurs when the skin rubs against a rough or a hard surface. So that would be like road rash. Now, a laceration, this is a deep cut or tear of your skin. It can be caused by knives, tools, machinery. A puncture, this is a small hole caused by a large pointy object, so a nail, a needle. An avulsion, now this is a partial or complete tearing away of the skin and the tissue beneath. Okay, so avulsions usually occur during violent accidents, so like body crush accidents, explosions, gunshots. The bleed is heavily and rapid. So how are open wounds treated? So now some can be just treated at home, but some do require a trip to your doctor or hospital. Now just home care for minor wounds. You're just going to first wash and disinfect the wound, removing any debris, dirt. Use direct pressure and elevate to control the bleeding and swelling. So you always want to, wherever the bleed is, you want it above the heart. Okay, so if it's on your arm, lifting it up above your heart. Now, if it's on a lower limb, this can be difficult because you want to elevate it. So lie down and have it elevated, like elevated up on something. If it's, say, on a leg, you want it above the heart. This means the blood flow is not going to be as strong because gravity pulls down our blood too. That's why we want it above, so it's harder for the blood to get to that area, slowing down the blood, the swelling. Okay, when wrapping a wound, you always want to use a sterile dressing or bandage. You want to keep the wound clean and moist, so putting like Vaseline on it for at least 5 days. And you should also get plenty of rest so it can allow that area to heal. Now, pain typically does accompany new wounds, so you can take some acetaminophen, such as Tylenol. Just take it as directed as the package. Now, you want to avoid products such as aspirin. Now, aspirin is a blood thinner, so it will actually prolong bleeding. Now, if you are on a blood thinner and you get cut, you will have to hold pressure on that area for a lot longer than, say, someone who is not on a blood thinner. Blood thinners thin the blood. It's a lot harder to clot. Now, if you have a wound that it just won't stop bleeding and you are on a blood thinner, and even if it's just minor, give your doctor a call and they will normally direct you to either stop the blood thinners for a day or two, just to give that time to clot. Okay, but definitely discuss that with your doctor before ever doing that. You can also apply ice to the area if you have bruising or swelling. And then you want to avoid picking at any scars. Now, we do know that a moist wound environment is better as it allows the wound to heal quicker. New research has shown this. But if a scab does form, don't pick it. It'll increase the risk of scarring. and open that wound back up. It just prolongs the whole scenario, okay? So yeah, just try not to be picking at those scabs. Okay, so when should you be seeing a doctor? Most can be treated at home, but once again, there are some cases that we should be seeing a doctor. So if a wound is deeper than 1/2 inch, you need to see a doctor because they will probably stitch it up. If the bleeding doesn't stop with direct pressure, if the bleeding lasts longer than 20 minutes, or if bleeding is a result of a serious accident, okay, you should always see your doctor. And I am going to just add one more there. If you have something stuck in your skin, say something has, I'm going to say a knife, for example, but I mean, people have fallen on like stakes in the yard, like a metal stake, a wooden stake. They were up on a ladder and fell onto it, impaled themselves. Never pull that out. Never, ever, ever pull it out. Go to the hospital with it in you, okay? If you pull it out, you could have a massive bleed and bleed out. We don't want that. Just take it with you to the hospital. Obviously, have somebody drive you. Okay, so medical treatment of an open wound. So there are a few different techniques to treating an open wound. So they'll first clean it, possibly numb the area if needed. Now your doctor may use skin glue, sutures, stitches, and you may also receive a tetanus shot if you have a puncture wound. Now, depending on the location of the wound and potential for infection, your doctor may not actually close the wound and just let it heal naturally, okay? It really depends on that location and potential of infection. Now, another treatment, they might put you on pain medication if you are having a lot of pain. They may also prescribe an antibiotic if there's an infection or high risk for infection, okay? Now, if you have a severed body part, okay, it should be brought to the hospital for possible reattachment. So you're going to wrap the body part in moist gauze, and pack it in ice, okay? You don't want it on direct ice, but you're going to pack it in ice, so make sure you wrap it in gauze first. Now, when you leave the doctor's office, you might have bandages or dressings. Now, it's really important that you're washing your hands and working in a clean surface area while changing these bandages and dressings, okay? So you're going to disinfect and dry the peri-wound thoroughly before dressing it again, okay? Now, complications from having an open wound. So the main complication, well, actually two main complications of an open wound is infection and bleeding. So a signs of an hemorrhage includes continuous bleeding that doesn't stop with direct pressure. Okay, so that's a hemorrhage. Now, you may also have an infection. Now, this will be seen by increase in drainage, thick green, yellow, brown pus, or a pus with a foul odor. Other signs of infection can include a fever over 100.4 or 38 degrees Celsius for more than 4 hours, a tender lump in your groin or armpit, normally whatever is closest to the wound, these are your lymph nodes, and a wound that isn't healing. Now, conditions that can develop from an open wound are lockjaw, necrotizing fasciitis, or cellulitis. So I'll start with lockjaw. This condition is caused by an infection from the bacteria called tetanus, okay? It can cause muscle contractions in your jaw or neck. That's why if you have puncture wounds, they say that you should get a tetanus shot. Now, necrotizing fasciitis. This is a severe soft tissue infection caused by a variety of bacteria, including Clostridium, Streptococcus, that can lead to tissue loss or sepsis. Okay. Next, we have our cellulitis. Now, this is the infection of the skin. It's not the immediate contact with the wound, but it's kind of on the tissues, okay? Now, you don't even have to have a wound to have cellulitis, okay? So that is all that I have for this video. I hope you did find it helpful for your daily practice, and I will catch you all in my next video. See you guys.